Colon cancer is one of the most common and preventable types of cancer, especially when detected early. Colonoscopies play a crucial role in screening, diagnosing, and monitoring colon health. This guide will cover why colonoscopies are essential, the recommended ages for routine screenings, how often you should be screened based on family history or remission status, differences between remission and cure, treatment options, biopsy recommendations, and recent advances in detecting and treating colon cancer. Why you should get a colonoscopy. A colonoscopy is a diagnostic and preventive procedure that allows doctors to examine the inner lining of the colon and rectum for abnormalities such as polyps, inflammation, or cancer. Here's why it's so important. 1. Early detection of colon cancer. Colonoscopies can identify cancer at an early stage when treatment is most effective. 2. Polyp removal. During a colonoscopy, doctors can remove precancerous polyps before they develop into cancer. 3. Prevention and peace of mind. Regular screenings can prevent cancer and provide reassurance about your colon health. What age should you get a routine colonoscopy? The recommended age for a routine colonoscopy depends on your risk factors. 1. Average risk individuals. The American Cancer Society recommends starting routine colonoscopy screenings at age 45. 2. High-risk individuals. If you have a family history of colon cancer or other risk factors, you may need to begin screenings earlier, often at age 40 or 10 years before the age at which your relative was diagnosed. How often should you be screened? The frequency of colonoscopies depends on your risk factors and medical history. 1. Average risk. Once every 10 years if no polyps are found. 2. Family history of colon cancer. Every 5 years, or as recommended by your doctor. 3. After polyp removal. Follow up in 3 to 5 years, depending on the number and type of polyps. 4. After being in remission. Individuals in remission from colon cancer should have regular colonoscopies every 1 to 3 years, based on their doctor's advice. Difference between remission and cure. Understanding the distinction between remission and cure is essential for managing expectations and follow-up care. 1. Remission. Remission means that signs and symptoms of cancer are reduced or absent. 1. It does not guarantee the cancer will not return. 2. Cure. A cure means that the cancer is completely eradicated and is not expected to return. 2. For many cancers, including colon cancer, doctors typically use the term cured only after a patient has been cancer-free for several years. Different types of treatment for colon cancer. Treatment for colon cancer varies depending on the stage of the disease, the patient's overall health, and other factors. Common treatments include 1. Surgery. The primary treatment for localized colon cancer involves removing the affected section of the colon. 2. Chemotherapy. Used to kill cancer cells or prevent them from spreading, particularly in advanced stages. 3. Radiation therapy. Often used for rectal cancer to shrink tumors before surgery. 4. Targeted therapy. Medications that target specific molecules involved in cancer growth, such as EGFR inhibitors. 5. Immunotherapy. Boosts the body's immune system to fight cancer cells. 5. This is particularly effective for certain genetic types of colon cancer. 6. Clinical trials. Participation in research studies exploring new treatments can be an option for some patients. When should you get a biopsy? A biopsy is a procedure to remove a small sample of tissue for examination under a microscope. You should consider a biopsy if 1. A colonoscopy reveals suspicious polyps or lesions. 2. Imaging tests, such as a CT scan or MRI, suggest abnormalities. 3. You have unexplained symptoms such as persistent rectal bleeding, unexplained weight loss, or chronic abdominal pain. Your doctor will advise you on the need for a biopsy based on your symptoms and test results. Advances in detecting and treating colon cancer. Medical science is continuously evolving, and there are exciting advancements in the detection and treatment of colon cancer. 1. Non-invasive screening tests. Stool DNA tests. Tests like Cologuard analyze stool samples for DNA changes associated with cancer. Blood tests. Emerging blood tests can detect cancer biomarkers, offering a less invasive screening option. 2. Enhanced imaging techniques. Advanced endoscopic tools provide higher resolution images and better detection of small polyps. Virtual colonoscopy uses CT imaging to visualize the colon. 3. Liquid biopsies. These tests detect cancer-related DNA in the blood, aiding in early diagnosis and monitoring remission. 4. Robotic and minimally invasive surgery. Robotics and laparoscopic techniques allow for precise, less invasive removal of cancerous tissues. 5. Personalized medicine. Genetic testing of tumors helps tailor treatments to the patient's specific cancer type. 6. Advanced immunotherapy. CAR-T cell therapy and immune checkpoint inhibitors are showing promise in treating advanced colon cancer. 7. Artificial intelligence, AI. AI is being integrated into colonoscopy procedures to improve the detection of polyps and lesions. Conclusion. Colonoscopies are a vital tool in the prevention, detection, and management of colon cancer. Understanding when and how often to get screened, recognizing the differences between remission and cure, exploring treatment options, and staying informed about advancements in medicine can empower you to take control of your colon health. Always consult your doctor for personalized advice tailored to your risk factors and medical history. Early action and regular screenings are the keys to reducing the impact of colon cancer and ensuring a healthier future. If this video was helpful, please like, subscribe and share this video to educate others.